Which of the following is most likely underlying mechanism for her recurrent infections? 1 week after starting amoxicillin for sinusitis, a 4-year-old girl brought to the emergency department with fever, rash, myalgia. She has been hospitalized multiple times for recurrent strep pneumonia and meningitis. She appears tired. The examination shows diffuse urticarial rash. Her antibiotic is discontinued. Which of the following is the most likely underlying mechanism of her recurrent infection? Okay, why the patient developed recurrent pneumonia or recurrent meningitis? Which of the following is the appropriate choice? The question is kind of explaining one thing and asking about other thing. Okay, the patient developed recurrent streptococcal pneumonia or recurrent meningitis. Why he developed this one? Okay, impaired leukocyte adhesion. Okay, impaired leukocyte adhesion during an infection is seen in leukocyte adhesion deficiency. That's, the patient have a history of, the patient has neutrophilia, and there's umbilical cord separation is delay, and there's omphalitis, there's teeth infection in that condition. That's not the right option here. Accumulation of bradykinin. Okay, in which condition we have accumulation of bradykinin? In which condition? In hereditary angioedema. We have acquired angioedema or hereditary angioedema. There is an enzyme called C1 esterase. C1 esterase, if deficient hereditary, if someone has inherited deficiency of C1 esterase, the patient will accumulate bradykinin. Bradykinin causes permeability of the vessels, also pain, also vasodilation. The patient develop like bronchospasm, like abdominal pain and swelling of the lip. There would be swelling in the mouth, face, this thing. This is hereditary angioedema. Okay, but we don't have urticaria and hereditary angioedema. Okay, defective membrane attack complex. Okay, membrane attack complex destroys gram-negative bacteria by making holes in the cell wall of the bacteria. By making holes in the cell wall of gram-negative bacteria, especially Neisseria meningitidis and Neisseria gonorrhea. Membrane attack complex destroys these gram-negative bacteria. Okay, membrane attack complex is formed from C5 to C9. Sometimes it's called C5B9. From C5 complement to C9, C5, C6, C7, C8, C9. It's formed by this complement protein in the blood. Okay, defective superoxide production. Okay, superoxide, for the destroying of bacteria by phagocytes. Phagocytes, I mean neutrophil and macrophage, destroys 98% of bacteria through the reactive oxygen species they form. For example, superoxide, hydrogen peroxide, hypochlorous acid. They destroy through these reactive oxygen species. Now 98% of the bacteria, but the remainder 2% are destroyed by the lysosomal enzymes. Okay. If someone is deficient in superoxide production, for example, it's called chronic granulomatous. The enzyme is deficient. It's called NADPH oxidase. Then the patient develop catalase positive organism infection, for example, Candida staphylococcus disinfection, recurrent disinfection, not streptococcal infection in this patient. Like this patient has streptococcal infection. Okay, impaired opsonization. Okay, what are the opsonins in our body? Anyone knows what are the opsonins in our body? What are the opsonins? What is opsonin? Opsonin is something that that cover the capsule of certain bacteria like Neisseria meningitidis, Haemophilus influenza, and strep pneumonia, and make them susceptible for phagocytes to swallow it. Okay, there are four opsonins. The most potent one is C3b complement factor, IgG antibody. Perfect, Dr. Rishida. IgA antibody, it's in some amount, and also C-reactive protein, CRP. They are opsonins. They help destroying capsular bacteria, for example, Haemophilus influenza, Neisseria meningitidis, and streptococcal pneumonia. Okay, if someone is deficient in the C3b opsonin, then the patient develop recurrent streptococcal infection, Neisseria meningitidis meningitis or Haemophilus influenza or these things. The right option is here, E. Okay, absence of IgA antibody, it's called selective IgA deficiency. Selective IgA deficiency is the most common primary immunodeficiency. The patient with selective IgA deficiency develop recurrent giardiasis. The patient develop atopy after taking blood transfusions, and also they have autoimmune disease such as celiac disease, and that's not the right option. The right option is choice E.
Thanks for watching. Please give a thumbs up and subscribe for more.